A very, very good morning to you. Welcome to Morning Cafe. This is, we're discussing matters of health, and today we're having a very kind of a practical session with Dr.Hamisi Kote. He's the director of Chiropractic. He's also the founder of the Human Garage group. But then you might have seen him somewhere around different medias, different internet, and commonly known as the Barefoot Doctor. Oh, yes. And today's conversation is one very interesting one. It really happens, by the way, in Kenya. And I'd really love to know, is it that most general practitioners, most even chiropractors, are they afraid into getting into this practice? It is the cranial fascial release. And he'll be telling us more about it. But then there's also a very beautiful lady here with us. She is going to be our, let's say, our patient here. And the set definitely looks amazing, as you can see. Wacha nianze, tunasemanga ladies first, but then let me start with you, Dr. I've definitely done the intro, but then you can also tell us who is Dr. Hamisi, and even for this conversation today, cranial fascial release.
Thank you so much for having me this morning. I'm really grateful for TV47 to have given me this opportunity to come and share something matters wellness. As you said, my name is Dr. Hamisi Kote. I am a chiropractor, a fascia manipulation specialist by STECO, and also the first teacher of fascia manipulation in Africa and first black in the world. I like pushing that one because, well, it's a good one. Number two is I operate a practice called the Human Garage, and our key function, our key area is to help people optimize their life, people to live a full life. That does not mean that you can't get sick, but if you help your body to function better, if you help your body to work better, then you have less chances that you require to go to see a doctor for some illness. Your body is able to do that. So this is what I would like to share with people today, things that we can do to optimize our health. Okay,
right. So before we get into this conversation, because there are two words here, there's cranial as well as facial.
Yes.
And as you can see behind the screen here, there are images that will also help the viewer understand what we are talking about today. So even first of all, you can also tell us what we are looking at here, as well, even as you also describe to us and explain to us in layman's terms without the very many medical terminologies here. What is cranial? What is facial? What are these two words combined together?
Thank you so much. Before I go into that explanation, I want to start with how life starts. When a baby is delivered, the first thing that the baby does is to make a scream. And this is the start of the baby introduction into the external world. This has a very important thing in us. Why? Because when the baby breathes in, they go into what is called sympathetic. Sympathetic meaning is a fight. They're trying to fight so they can breathe enough to be able to survive. And at the same time, we have what we call the parasympathetic. Parasympathetic is what we do when we leave the world. We exhale out when we leave the world. So once we understand those two things, then we understand that oxygen, or rather breathing, it's a key fundamental, is the most important exercise in the human body. Why? Because it's that exercise that helps directly introduce oxygen into the body, and it's oxygen, we know that's the fuel of the body. Now let's look at what our topic today. We need to understand that the head, which is what we have here. The head houses the brain.
Right.
And from the head, we have these bones all the way to here that again house the spinal cord. So what is called the central nervous system is housed in a cage of bones. This is important, and it's the only tissue in the body that has this kind of covering. Why? Because the central nervous system is the communication center of the functionality of the body.
Right.
Now, if this is the communication center, and if this is where everything important happens, then it is important for us to understand how this segment can be influenced to help the general health. Now, cranial is the skull. The skull is made up of 22 bones.
Okay.
and it's made up of 64 articulations or 64 joints. Like if you can see, we call them sutures, but as you can see, there are all these small lines that are supposed to mimic a suture. That means that the head, the way we see it, is not one continuous bone like most of us would think.
Right.
It is not a continuous bone. And the other thing that we need to think about or remember is that when we breathe, the cranial sutures kind of expand and relax, expand and relax. This is something that most people don't know.
Right, as you say that and as I'm breathing in and out right now, I'm so aware, I'm even starting to think about, is it happening?
It does. It has to happen. It must happen.
So it happens without even us realizing.
It's a subconscious action. It's one of those things that we don't have a control of.
Okay.
Now, this expansion and relaxation, we can also move it further to see it in what we call parastosis. Parastosis is the movement of food or movement of food inside the gut. When ukitafuna lazima utafune alafu umeze. So it's the same, opening and closing. We call it stretch and relaxation. The body has to do that, both conscious and subconscious. Conscious for the muscles. When I want to stretch your arm to say hello to you, I have to do it intentionally. So I have to contract it and relax it. The same when we breathe in, when you blink, and all this functionality of the body have to have this expansion and relaxation. Once we understand that, therefore, then we now come back to know then other than the skull, what else do we have on the cranium? We have muscles, and we also have connective tissue. The connective tissue here is collagen, or what you call fascia. Fascia is when you're eating meat, there's that something like a nylon. You know, there's something like a nylon you pull, or even when you're skinning an animal, you find this white tissue.
Okay.
Yes, or even when you're eating meat and there's that final thing that you want to scrape off the bone. That is what we call fascia. Now, fascia kind of encases muscles, nerves, blood vessels, lymphatic ducts, and everything in us together. It's put together they hold this together so that you can be able to initiate movement or be able to initiate activation in very specific way. As a result of that, therefore, we have come now to know than we knew before that the fascia tissue is key in pain. It's key in stiffness. It's key in the functionality, the general wholesome functionality of the human body. And if that is the case, therefore, we said we have sutures. So you can understand that if these sutures are covered by something else, like a socks, and they're supposed to be expanding and relaxing, if these socks get tight, stiff, then that expansion and relaxation will be affected.
Right.
So when we talk about craniofacial release, we're talking about releasing that tension that is in the skull and that is in the fascia tissue. Why do we need to release that? We need to release that because science and research has shown that any change of mechanical increase in cranial pressure will affect the general health of how the body functions. Why?
Right.
Because we are affecting the communication center. We are affecting the powerhouse of the body. So, for that reason, for over 100 years now, various several doctors, including medical doctors, have come up with various ways of trying to ease off facial congestion, snoring, sleep apnea, trauma to the face, sleep disturbance, difficulties in breathing, sinuses as well. Yeah. And also, what people don't know is that when we have a problem here, 80% of the conditions that happen here in the gut can be influenced by just a little bit of pressure in the cranium.
And Dr. one of the most controversial methods of the release is, I see you also have it here,
yes.
The two balloons here, the balloon method. First of all, why is it used? I mean, it has been since the 20th century, the 90s, back in the 90s, it is globally used. We'll be getting to see it practically here with Valentine here. She'll be introducing herself and she'll be telling us why she also wants to have this, you know, to even experience this really. So first of all, why is the balloon method used? Why is it so controversial? Because other doctors seem not to really agree with how it is used.
Fair enough. There are two procedures that can be done for helping in breathing. One is called sinuplasty. Sinuplasty is done by a medical doctor under anesthesia. So if it has to be done under anesthesia, therefore, it's painful. You cannot just walk in the clinic, get it done and leave. Why? Because in sinuplasty, a medical doctor inserts more like a probe that has something like a balloon inside the sinus cavity. You have this sinus, you have this sinus, okay? So the doctor will go in there in case of a congested sinus, put this probe inside, expand it, and then that expansion helps the sinus to drain off the mucus that is in the sinus. That is a medical procedure. Then we have, on the other hand, what we are doing as a craniofacial release. Craniofacial release, the difference is we don't put the balloon into the sinus cavity. We put the balloon in the nasopharynx. Okay, and in the nasopharynx, we have 3 openings in either side of the brain of the nose. We have like 3. There are 3 kind of openings in either side. There's the upper, middle, and lower. And it's from your examination that you decide which one you put in for better results. Number 1. Number 2 is that when we put the balloon into this space, this is the space where if you may, it's under a bone here which we call the sphenoid. The sphenoid bone, which is where the brain will sit on from the top, kind of does this. It kind of works like a fulcrum, if you may, something like would be doing like this. And its main purpose is to help the flow of the cerebrospinal fluid in and out of the brain. Now, whenever we have a fixation, a distortion, a tension, an injury, something that affects these breathing patterns also gets the sphenoid bone or that to be stuck or to be fixated. Okay. When this happens, it affects the flow of the cerebrospinal fluid, and as a result, increases the cranial pressure in the skull. Right. Now.
And actually, because I know we can really get into the theoretical bit, yes. And I really want even to get a huge percentage into the practical. But then before we get here,
the practical is very short.
Naona pia kuna our human model, yes. Wa the whole nerve system and how it looks like. Naomba kama anaweza karibia pia yeye, just to also help us understand how the nervous system looks like, even as he also comes on board.
Yeah, so I was explaining the importance of having these bones to move, and the importance of the flow of the cerebrospinal fluid, this fluid that flows within the spinal cord. Now, what we need to understand is that this cerebrospinal fluid, if the pressure inside affects it, then there is always a buildup of pressure that will result in anomalies or dysfunctions that will end up causing us to have the sinus, causing us to have the breathing difficulties, causing us to have the sleeping apnea, causing us to have the snoring. And it is putting the balloon there and mobilizing the bones. You know, chiropractors, their work is to mobilize the bones. When we mobilize those bones, then we restore. Right. We restore the functionality. To answer your question why most doctors are controversial about it, it's because they don't know about it. They don't know about it. They have not had an experience. Anyone commenting about it in sub-Saharan Africa is just doing out of gossip. They have not experienced it because it's not painful. It's not a painful procedure. It's a 2 minutes, it's a 2 seconds procedure. And the patients who come to see us, they come as the last resort. Right. They have had either sinus surgery, they have had other procedures that have been done, but they still cannot breathe. Why? Because most of the time, for example, if you have, let's say if you have a deviated septum, or let's say if you have polyps or something in the nose. For modern medicine, they are properly trained to treat signs and symptoms. What does that mean? It means you can't breathe, we look at your nose, we open the breathing. But as a chiropractor and as a fascia manipulation therapist, I am trained slightly different to look at function, not signs and symptoms. I'm trained to look at function. So I address a patient to look for this function. Right. I am not here to say I treat this and this and this condition. No, I am here to say I correct the dysfunctions that make us get the diseases that come as a result. And for us to be able to do that, we have to go back in history of the patient. Yes, we have had they are not breathing well. We have had they're having headaches. Okay. We have had they're having something else. Right. But I go back further to be able to understand why.
So it's just not about the whole release, but then also looking at the history. Hold on to that thought. Allow me to pick our model. Okay. Naambiwa lazima nimsaidie ingie kwa set vizuri, pole pole. So yes, just walk straight to me. My name is Stanley Nyerungita. I'll have you stand somewhere here. Yes, so just next to our... so this is this whole skeleton. What are we looking at here, Dr.?
I brought this suit to be able to explain what the fascia is, that meat thing that we talked about,
right.
And how it's interconnected in the whole body.
Okay.
So we are all versant with traditional way of looking at the body, which is the skeletal system, and the muscles that would form on the skeletal system. Right. We all are very familiar with the fact that we look at muscle in terms of origin insertion. Okay. It bends the elbow, it straightens the elbow.
Right.
We have now had a lot of research that have said, no, the body does not work that way. The body works as a unity, as a unit. Okay. So if I want to do an arm extension, it is not just one muscle. It's a sequence. It's a sequence of events that happen for me to stretch my arm or to grab something. Not one muscle, not two muscles, but a sequence.
Right. So point made. So what I want to really focus on right here is, before we get into the practical, I want you to paint the viewer a picture of what they're going to be experiencing here on the table using this model, this live model. Because now here I can probably see some nerves, the whole tissues and everything. So because you've told us that we're going to have the balloon through the nasal cavity.
Yes.
And you're going to be seeing, because I think there are three. So which one will probably work? So using this model, what are we going to be doing here so that before we see it on the table?
Very good. So the first thing is to show people how the body is interconnected.
Yes.
So a patient may have sinus, may have sleeping problem, may have headaches, may have all these cranial problems, but they did not originate here.
Okay.
Why? For example, let's say this gentleman, he fractured his arm when he was in primary. And when he fractured his arm, this is what happens to the body. Can you see a difference in what is happening in the tissue there?
It stretches it.
It is stretching. So if, before I do that, if I asked him to move the arm up, straight, like that, without the folds, and then if we do this, which is what will happen after a fracture, and then we tell him to raise the same arm, you can see a huge restriction. Okay. That restriction is not only here, it can also travel to the face to cause this to do this. Of course, you'll not see it outside on the, you'll not see it physically, but the patient will experience it in terms of a blockage, in terms of congestion, in terms of I can't, in terms of tightness, in terms of constriction.
Does it happen instant or after a period of time? You probably had a fracture earlier this year. Do you get it instantly that January or December and so you start feeling it?
No. The body is a very good compensator. So if you have a fracture here and it gets this tight, it will compensate and compensate in other areas, even on the lower legs or on the back, to bring back the body into some sort of equilibrium, so that it can continue functioning.
Right.
But as you're getting older, the thickness of the fascia changes. The amount of collagen in the fascia changes, and there you start losing that elasticity that you had as a child.
Right.
That is why when you were in primary school, it was easy for you to squat.
Oh, yes.
Okay? But now, a lot of us cannot.
Kwa zile backflips.
Yes.
Nilikuwa mnoma.
Lakini sahi ukifikiria unaanza kufikiria utagongesha kichwa. Why? Because your body has become stiff.
Oh, yes.
It's become tight.
I can't even dance right now. I used to dance.
So, yeah, and this is the tightness that happens over time. So this tightness here, for example, of the fracture, over time might start having him start getting, let's say, chest infections, recurrent chest infections, chest pain, acidity. And the doctors who will not treat, they will not address the fracture. They'll come here to address signs and symptoms. So the patient will be treated for chest infection and they'll get better. But that chest infection will also give us maybe stomach problem, gas, acidity, constipation, whatever. And that continues. And then the doctor who treated this one, or another doctor who treat this one as this, and not even remember to address this. We're together?
So where does now, because of time, I really want to now get into the point of that.
I want to get back to where your question. Yes. So this compensation will cause here to be like this.
Okay.
On the inside. So what happens on the inside if you compress something? All the openings will do what? They will shrink.
Yeah.
Okay? So what we say we do is that using fascia manipulation, which is a very specific anatomical biomechanical model or method, we have specific spots or points according to how the nerves are laid out in the body that we are able to examine and be able to follow from here, from the fracture. We find from here to understand how it came here and how it came here and see what we need to release here and release here to get the fascia tissue first of all free, and then we need to get our balloon here to mobilize so that we can adjust the skull and allow the bones to
let me interact with Valentine. Hi Valentine. How are you? I'm good. Normally mimi nikiendanga hosi ukivalishwa maneno unakoga na butterflies in your stomach. Do you have butterflies in your stomach because you're a patient of the day to day?
Not really.
You okay?
Yeah.
Why this? First of all, when did you ever get to know about cranial fascial release?
Like 2 weeks ago.
2 weeks ago?
Yeah.
Were you specifically researching about it, or did someone tell you?
Someone told me.
What's your idea about it? And considering the fact that it really rarely happens in Kenya, not so many practitioners are doing it.
I would like to try it simply because I've been to hospitals, been given medications, and it does not work. So I hope and pray this works.
But you've watched a number of videos of what happens.
Yeah.
I've also watched them, and truth be told, there's a certain type of way you feel even in your nose that it's not you, but then when I feel, hey, are you ready for that?
Yes, I'm ready.
Right. My director Kevon asema tuende for it. He's really ready for it because we've definitely explained it.
Yes.
I'd love to also see the practicality of it, so that we also understand. When you say some of this nasal activities, the whole balloons and everything, without much ado, to give the whole practical session of it.
Fair enough.
Yes.
So maybe the first thing we need to ask is why she's here. Valentine, why are you here today?
I'm here because I've just answered that I've been to hospitals, been given medications, and it does not work. So I'm here to hope itafanya kazi. I hope itafanya kazi.
What is your problem? Would you mind to say the problem?
Yes. I've been having headaches, coughing since 2020, homa haishi, nikienda hosi napatwa medicines, it does not work. Nimeenda hata kutest pneumonia, hakuna. So I don't know.
So this is the kind of patients mostly we get. We get patients who have done, patients don't come to us straight away when they have issues like this. They go through the round and they go through other practitioners. So I did a history. We had to do a history because we can't just come on a TV and start treating a patient. So we did a history. We did our collective history taking. We did our functional test, and we we came up with an idea of what we think the problem is. One, she has numbness in her hands, right?
Yeah.
Both hands. And she also has numbness in her feet. So these will be some of the things we'll ask what will be the changes? And then also she has congestion. Which nose is more congested than the other?
This one, right now.
Right now, the right one is more congested than the other.
Yeah.
And where do you get your headaches? Is it here? Is it on the side? Is it
At the moment, it's everywhere.
It's everywhere?
Yeah.
Okay, fair enough. So what we'll do, I'm going to have you, before we have you lie down, I want you to come up here and do for us just a simple squat. Come here and do for us a squat. Just the way you do a squat. Don't think about it, just do a squat.
Oh.
Okay. Is that normal, or that's just the first time?
Yeah, let her do it again.
Okay.
Maybe she's nervous because of the TV.
Right.
Let her do again the way you do it. And this time, let's not lift your heels. You see, even lifting with her heels, she cannot keep her balance. But try to put the heels on the floor. And then do the squat. Both heels on the floor and do the squat. Tell us, what do you feel?
My heart rate.
What happened to it?
It's moving fast.
Okay, come up. The next thing I want you to do is when your legs are together, when the legs are together, I want you to turn as much as you can, whichever side you like.
Okay.
Any pain?
Yeah.
Where?
Here.
Where?
Here.
You have pain there. Okay, let's turn this other side. No, don't move your legs. Any pain? Where? Same place?
Here and here.
Both sides. Okay. Can you blow your nose? One nose at a time.
Mucus will come out.
Oh, mucus will come out?
Yeah.
Okay, fine, no problem. So come here. Lie on your back facing up. If you can have some tissue, because when we do the procedure, we'll need some tissue. Okay. So what I'm going to do, I'm gonna feel different parts of her body.
Okay.
For me to be able to establish a diagnosis first. And then we're going to go on with the procedure. Is that okay? So I'll touch several spots on your stomach, from here to here, and you'll only tell me which one is painful. Okay. Any pain here? No. Any pain here?
There is pain.
There is pain here. Okay. Any pain here?
So even as you continue, because I mean the viewer is really also trying to understand.
Yes. So the first thing is,
okay.
I said the use of a method called fascia manipulation.
Yeah.
So for me to be able to understand what to treat and how to treat it, I need to be able to establish which sequence of the body or which meridians, if you may, people may know meridians more, is more affected.
Right.
And from there, then I'll know how to treat it.
Right.
So that's why we have a meridian here at the center, this way, which is both right and left. We have another one on the side, right and left, and we have another one that rotates back and forth, giving us this movement, and this movement.
Is it just chiropractors who would do this, or even general practitioners?
If you practice this method, this is how you do it. It's a way of assessment. It's an assessment tool that you're able to check before and after. And an assessment tool that would help you know what you have done. It is a systematic, it's very precise, like it's very specific. It's something that if I do it now and I give you my notes, you go to the US and you find someone else who does fascia manipulation, they will do exactly what I've done. That is why it's a very systemized way of doing it.
All right.
Yeah. So we got here, painful?
Yeah.
Okay. Painful? Painful.
Yes.
Okay. So we compare that one with this one. Painful? No. Painful? No. Okay. Painful? Okay. Painful? So we have this being more painful than the other two. So I normally have to come up here also and check. Painful?
Yeah.
No. Okay. Painful? Painful? Oh, more painful here. All right, good.
So roughly how long does this process take?
Oh, I'm done.
Okay. So the targeted muscles that
this
you go for?
Or this?
This one.
This one. Okay. Pardon?
The targeted muscles that you go for?
Targeted points.
Targeted points.
Yes.
Okay.
Yes.
What are those, this specific
These are
points that you're going
points.
for?
These are called diagnostic points.
Oh, okay.
I find this more painful, correct? So I already find my problem. Our problem is more this side. It's more this side than this side.
Right.
So my question for you, do you feel any one side being heavier than the other? Or being more strained than the other? No. Okay, fine. So let me tell you what I'm going to treat. I'm going to treat this one.
And
I'm going to treat this one.
So a quick one also for you, Val. Now for these pains that you're mentioning, did you start feeling them after at what point after 2020?
Around 2012, but they were not...
Oh, 2012?
Yeah.
Okay.
So 2020 is when they started being severe.
Okay.
Yeah.
So I think I'm ready to what I'll do for her.
Right.
This is more painful than this one. So there are two ways of doing this. I can use a needle. I can use my hand. What would you like us to use?
For what exactly now?
We are treating the craniofacial release. But before we go to the craniofacial release, we have to work on the connective tissue.
Okay.
Because when we took her history, when we took her history, that's how we were able to pick the numbness. That's why we were able to pick some pain at the back.
Right.
And we were able to pick pain here. At the same time, we are able to see, or rather understand that when she has had a lot of issues here. Remember I said, when you have pressure here, it gives 80% of the problems that happen here in the gut. So when we checked her history, we have a lot of issues with acidity, gas and bloating here. So as I treat her, I'm not only treating that, I am treating Valerie. It's a holistic approach. So that's why I'm saying...
So that means whatever you'll do for the nasal cavity...
It's part of a holistic treatment. Remember what I said, we treat function, not signs and symptoms. I'm not gonna just come here and start doing congestion. No, I have to address her as a whole, because that's how the body works. The body does not work in segments.
Is this a silver bulletproof approach when you use the balloon method?
What do you mean silver bulletproof?
What I mean is, if you, because you said it's about 2 minutes, actually about 2 seconds.
It's a 2 seconds.
2 seconds. So
yes.
After you do it,
yes,
will she not feel the pain that she's feeling across the body?
That's the game of that's the reason why we're doing this today. We wanna. She's feeling pain right now, and we'll ask her, out of 10, how much pain do you have?
So after
she should have 0 or maybe 1.
Okay.
Yeah.
So we wait to see.
That's what we need to do. So, do you want us to use a needle, or let me ask you? Do you want us? Let me ask you. Do you want a needle? Or do you want hand?
Probably you can show us maybe the size of the needle.
Oh, the needles vary. The needles vary. The needle is just a tool.
Yeah, manze.
It's just a tool. It's just a tool. So they're in different sizes. There are small ones. There are big ones. But the needle size does not matter. The needle size is only dependent on where to use it. So if I'm using it on a buttock, I'll use a long needle. If I'm using it here, I'll use a smaller needle. If I'm using it around the eye, I'll use even a smaller needle. So the size of the needle is not a big issue.
Right.
Yes.
Let's say, in consideration of time that we have here, if we're going to, let's say, pick a needle, so are you going to be having it on a part of her body, or?
Yes, I'll have needle here. I'll have a needle here. I'll have a small needle here. One here and here. And
so it's extensively piercing it inside? Or
just put it. It's not. Just go in slightly.
All right.
Yes.
So it's basically just pricking it, pricking the skin.
Yep.
Okay.
Let's use the needle because it's faster.
Right.
It's faster because of time.
Val, do you consent to that?
Okay. Cool. Okay, and then don't start asking why I don't have gloves. I practice old school medicine, and in old school medicine, gloves are good, but gloves can be clumsy. You can easily end up pricking yourself. So we sanitize, we clean our hands, and whenever I'm doing this, because I work on very small places, I want to be sure what I'm doing so that I don't prick myself and I don't hurt the patient. Nor do I spread infection.
Right.
Okay.
So now after that is when we go for the balloon method?
Yes. After this, now the body will have calmed down. We'll now do the balloon and do the other adjustment and we're done.
So what's the main purpose now of using the needles? Is it to tell you where the pain really is? Or
no, it's to relieve the pain and the congestion and the cough that she's having.
Okay.
That's the main reason.
Okay.
Yeah.
So being told you have about 10 or so minutes.
I'll be done in 10 minutes.
This is the part where even as a doctor unaanzanga kuambia your patient stories za jaba ndio relax. Because I'm trying to imagine if it were me who's there and
this one
pricking quite a number of needles on my body.
I'll tell you something. We fear needles just because we had a lot of them when we were younger.
Oh, yes.
But acupuncture needles are not as painful. Done.
So how many to go?
That's one. Do the next one.
Hii lazima ukuwe na high pain.
It's not painful.
It's not
as you think. No.
Pain is subjective though.
As you think.
I'd love to think pain is quite subjective.
You can ask her. She's getting it and tells you if it's the same as what she thought.
Val, how are you feeling?
I'm okay.
Is it as painful as you thought?
No.
It's not.
Okay.
It's the same when somebody watches cranial release, thinks it's very painful.
Na hii skin yangu ngumi. Mimi naona niko na skin nyingine ngumu sana.
All right, and then the final one is here.
And so for this one, no blood.
No blood. No blood. Why? Because the size of the needle is very thin. It's very small. That
for the nose is the smallest one.
The small needle, yes. Done.
I think this is the fact that Sahi, when you're watching this morning, this is the part that I tell you, do not try this at home.
Yes, don't
let someone who's quite experienced do this. As we discussed, this matters cranial fascial release. Do not try this at home. Siende kujaribu needles juu uliambiwa ina release. Yeah.
Okay, I think we are done.
So how many to go?
No, we are done.
Oh, we're done. Oh, it was just having it in and then...
Yes, and out.
So what are you exactly doing there?
Here I'm just now just slightly mobilizing what I've needed.
Is she supposed to experience that?
It's a bit painful, yes.
Okay. Typically, she used to feel the pain on that
This area?
on that area, ama it is expected?
No, there was no pain from this area. There was only numbness. Yes. So fascia manipulation is it's a 3D biomechanical model. Understanding the anatomy of the body and understanding how the fascia forms a 3D tensional network to be able, one, to move the muscles, but most importantly, to maintain circulation, blood vessels open, airway open.
All right. So even as you continue, because of time, before Nisahau could run through you this, I spoke to other medical practitioners on just this.
Yes.
And the kind of queries that were raised was, number one, what if the nasal cavity is blocked? Number two, can this be a short-term kind of approach?
This is what I want to say. It is not a one-off treatment, because like any other disease, there's nothing that can be treated just a one-off. You're trying to correct a dysfunction. This dysfunction, for her to be able to be in a position that she is having difficulties in breathing, she's having chest pains, she's having gas and bloating, acidity, it must have been there for a long time. So even for us to be able to fix a patient with this kind of problem, it's a process. It's a couple of at least, we do what we call the 12 weeks to wellness. It's 12 visits of treatment. So we start from this first stage, which is called the painful stage. And from the painful stage, we go to stability, and stability to wellness. Like for her, because she has agreed to come and do this for us, we have offered as a clinic to do for her the 12 visits at no cost. And maybe when it will be in 6 months, when we finish, maybe we can bring her here and we check a review. It gives us a feedback. So
does this mean in the 12 weeks, if you did for the first week the balloon approach, chances are in these 12 weeks you might be forced to again do it, or what do you mean?
You do the balloons about 4 times.
4 times after?
4 times in the 12 visits.
Oh, okay.
You do the balloon 4 times. And then after you've done the balloon 4 times, within these 4 times, she's doing some nutritional care, because we saw the gut is affected. She's doing some exercise to help whatever we have restored stay that way.
Right. So that answers on the short term. But then now what about for the nasal cavities? Do they get blocked? What if, again, because I mean you're using a foreign object here, what if it gets blocked by any chance inside the nasal cavity?
It can't. It can't. We are trained to do this. It's a proper training. It's a proper real training to do this. You just don't insert balloons without proper training, without proper understanding of what you're doing. You have to do it knowing exactly what you're doing. It's the same. Right. A medical doctor will learn how to do a surgery.
Even as you do that, we have about 3 minutes, to wrap it up. So this is the part that we've really been waiting for. You can also walk us through what exactly you're doing. What kind of a balloon is that? Is that just the normal?
This is a finger clot balloon.
Sorry?
It's called a finger clot.
Finger clot.
Yes.
Okay.
Finger clot balloon is it's a tiny balloon. It's very tiny, like you can see it. It's very tiny.
It's not a regular off-the-counter?
No.
Okay.
No, this is specific for this kind of work or other kinds of work.
Right.
So, from her case, this is the side we find an issue. And this is the kind I'm going to balloon. I'm not going to balloon both sides.
Okay.
I'm going to just balloon one side. So what I'm going to do, I'm going to insert this balloon up inside your nose. I'm going to ask you to breathe in and breathe out. And then the next thing, you breathe in and hold. I'll pump the balloon. Don't hold my hands. You have to keep your hands here. There will be a lot of pressure, not on the nose, but on the face. That is what people think is painful. And then there will be a lot of cracking. And in 2 seconds, it's in and out, okay? So let's do it. No, don't run away. Are you ready? Okay, let's do it. Don't run away, because if you run away, then it means it comes out. There you go. Now, I want you to relax. First of all, relax. You relax first. Now, take a deep breath in and out. In, hold. You're good. Just breathe. Can I
So,
have some tissue?
and so in your training, because I mean, you definitely experience this. So what technically happens because for a number of...
There's a lot of pressure that you get on the face. And at the same time, there's a lot of scary cracks that happens in the whole of the skull. And then once you remove the balloon, that's it. How are you feeling?
So so it's done.
This is done. Now the next thing is just to adjust her, to make sure I finish the adjustments. Relax your neck. Relax your neck when you're ready. Uko sawa? Uko ready?
How are you feeling, Val?
How are you feeling?
Deep breaths.
You okay now?
Does that need a warning before you do it, or you always have to?
If you tell the patient, they'll stiffen up on you. So let's go. There you go. Let's go. Let's go. One more spot. When you're ready. Here. This or this is painful. Which one is painful? This or this? Which one is painful? This one or this one? This or this? I feel like this is painful. What you see coming out is a lot of the sputum. Let's go. Breathe out. There you go. Lie on this side, facing me. On the side. And then come forward. Are you okay? Are you okay? Why are you crying? Why are you crying?
Do you feel so that even
give the viewer a feedback? What did you feel? Yes. What are you feeling? What is making you cry? Maybe that would be good for you to do.
You can take a moment to breathe. Yes, you can probably have the tissues here. And Dr. Nora, because of time again, you can really wrap it up as we also help us understand, even for the viewer. They've seen this through explaining from the skeleton, from the fascia, from the tissues, all the way until to this practical.
Yes. So one thing is that when the balloon is inserted in you and is inflated, there's this massive pressure that you get on the face. This massive pressure that you get in the face is very scary because of the cracks that you get into the head, number one. Number two, after you've done that and you've removed the balloon, the patient feels a lot of drainage, a lot of things pouring at the back of the head. And then that's it. So maybe she gives us a feedback. Yeah. Are you okay now to give us a feedback? Maybe sit, please sit. Facing that other side.
Probably help you.
Are you okay?
Yes. Okay.
So, give us a feedback.
As we...
Yeah, because...
Malaysia, yes.
Because
you feel... what do you feel right now in your nose, in your head right now? Unasikiaje? Headache.
Hii side kuna mucus.
Okay.
Unasikia kitu ina drain? A lot?
Yeah.
Right.
Okay.
So
can we also do the squat as the test? How is your heart?
I can't feel.
You can't feel it. Come up. Legs together. Turn as much as you can. Are you in pain?
No.
Turn the other side. All the way. Are you in pain?
No.
So, basically now what she'll experience after this is that, again, remember the skull was like this for a long time.
Right.
So in the next day or two, you have just opened this thing like this. So what have you done? You kind of caused some inflammation.
Right.
That inflammation will cause her to get that kind of, a bit of headachy.
Right.
She also may feel a bit stuffy, but this will clear in the next 2-3 days.
Right.
Yes.
Right.
And what she'll feel is clarity, mental clarity. She'll feel the brain is very, very clear, and her breathing becomes very easy.
Right. Right. Thank you very much, Valentine, for being part of us here, for being very emotional right here. And the viewers can even learn from all these conversations. In case you've just joining us right now, you can definitely take a look at our YouTube channel. Thank you very much, Daktari. A sentence, kindly. Yes. Make it a sentence as your last thoughts. A sentence, very quickly. And also where to find you very, very quickly.
So I want to say that craniofacial release is a procedure that is good for everyone, from very small children to adults, regardless of age. It is an important treatment to enhance health and wellness. Most importantly, to enhance breathing.
Right.
We at the Human Garage are located in Parklands on Msanaka Road.
All right.
Yes.
Thank you very much, Dr. Hamisi Kote Ali, Director of Chiropractic. He is also the founder of the Human Garage Group. And on behalf of everyone right here, it's a very big team that made this production possible. Go ahead for now. Have yourself a marvelous Monday morning. Goodbye.